Immediate evaluation in the cath lab after a balloon mitral valvotomy, also known as percutaneous transmitral commissurotomy, is by the balloon catheter itself. The balloon catheter would have slipped back into the left atrium after dilatation of the mitral valve. So catheter tip will show the left atrial pressure and it would have decreased significantly. And if there is a pigtail catheter in the aorta, it can be pushed into the left ventricle and the diastolic pressure in the left ventricle can be measured. So the difference between these two will give the transmitral gradient, and that is what we want to know, because a decrease in transmitral gradient significantly would mean that balloon mitral valvotomy has been successful. Another factor in the left atrial tracing is that if there is a very prominent V wave, then you know that there has been severe mitral regurgitation, and in the most severe case the person can go in for acute pulmonary edema, but that's very rare with good preparation and good precautions. If echocardiogram is available in the cath lab, it can definitely evaluate mitral regurgitation. It can evaluate the adequacy of split, as well as if there is any pericardial effusion. Sometimes there could be some punctures occurring inadvertently and causing pericardial effusion. That can be easily made out by an echocardiogram, and in case it is a significant effusion, you can put a transpericardial aspiration catheter and deal with the emergency as needed. That's why availability of echocardiogram in the cath lab for balloon mitral valvotomy is very useful. This is an echocardiogram in rheumatic mitral stenosis after balloon mitral valvotomy, still showing the doming of the anterior mitral leaflet labeled AML and paradoxical movement of the posterior mitral leaflet labeled PML in diastole, indicating partial commissural fusion. Left atrium is mildly dilated, right ventricle RV, AO aorta, LV left ventricle. Mild regurgitation is seen as a mosaic colored jet into the left atrium in systole. The aortic valve is in the open position in systolic frame. Mitral valve is in the closed position. Planimetry shows good valve area after a split of the commissures with BMV, balloon mitral valvotomy, also known as PTMC or percutaneous transmitral commissurotomy.